Thousands of people are diagnosed and treated for various kinds of cancer every year. But sometimes the quality of their diagnosis and treatment depends on who they are, where they live, their age, race, and sex. There's a major nationwide study, which includes the Mid-South, looking for ways to eliminate those disparities. Doug Johnson has more on this effort to keep more people well beyond a diagnosis.
There's a serious problem in the Mid-South when it comes to breast cancer, despite efforts to encourage screening or provide treatment.
We have particularly crying needs for this in our community because we have some of the worst disparities in cancer outcomes in the nation.
Statistically, black women are actually less likely to get breast cancer than white women. But in the U.S., once black women have breast cancer, they are 10% more likely to die than white women. The problem is even more serious around here.
In Memphis, your risk of dying of breast cancer is more than twice the risk of a white woman. If you're black, your risk of dying of breast cancer is more than twice the risk of a white woman. That disparity is the widest disparity in the United States of America.
Dr. Edge, director of the Baptist Cancer Center, says the problem extends beyond breast cancer to include other types of cancer, infant mortality, diabetes, and other problems. One of the best ways to find effective answer to medical issues is testing medications and treatments through research.
And it's only been because we've been able to do clinical research, and it's only because millions of people with cancer around the world have voluntarily participated in clinical trials.
Tremendous progress has been made in dealing with many childhood cancers, mainly because 70 to 80% of children with cancer take part in a clinical trial. But only 2 to 3% of adults go through clinical trials, which is only part of the problem.
Historically, those clinical trials have primarily or disproportionately included white people. And other racial groups and ethnic groups have been disproportionately less represented in clinical trials. So we don't really know for sure that all those populations will be affected equally by the benefits that we gain from the clinical trials.
To reach out to medically underserved populations now, which include minorities and people in rural areas, the National Cancer Institute has created NCORE, the NCI Community Oncology Research Program.
12 of the sites around the country are focused on recruiting and understanding care in minorities and historically underserved populations.
As part of NCORE, local oncologists and primary care doctors, along with community health organizations, will encourage people to take part in approved trials. NCORE began in August 2014 with a goal toward improving community-based cancer research. For Smart Medicine, I'm Doug Johnson.